Hello, everyone. This is Superintendent Peter Olsenskog, and I'm here to talk about healthcare insurance. We've tried various ways in the past to communicate this, and so we're going to try video and see if it helps. So, in 5, maybe 10 minutes, I'm going to cover 5 topics. So, I'm going to cover what it means to be self insured. And the reason I'm covering a lot of these topics is because there's a lot of misunderstandings about a lot of these things. So first, what it means to be self-insured. I'm going to talk about our health insurance situation. In short, we've got some financial issues we got to work through. And what makes up a plan design. What are some things now that we can help each of us do to help some of the financial situation that we're in? And then I'll recap and talk about next steps. So let's first start talking about being self-insured. In short, what that means is that we all contribute to a shared piggy bank. I'll use my cup as the piggy bank for today. So instead of paying this insurance company out there, each paycheck, you and the district, your deductions from your paycheck and the district contributes on your behalf. So they are all putting money into this piggy bank. And that covers all of our medical expenses. So the difference with self-insurance is that there's no one profiting here. It's a system where we all contribute and then we all benefit when we need care. So for those of you who are wondering what role does UMR play in this, essentially their administration. They do the talking between the doctor. So you go to the doctor and then the doctor talks to UMR and they says, well, this visit costs $250. And then UMR says, yep, it's covered. And then sends basically the bill to the district, and then the district pays for that out of here. UMR is not paying the bill, we're paying the bill. We pay them a flat administrative fee to do the talking. So what's the situation? What's the financial challenge? We're in part 2 here. The challenge is that our piggy bank, the amount that's in it is going down. Before COVID, we were at about 4.5 million, and now we're right about $500,000. And what's that due to? It's really due to the amount that's coming out of here is increasing because of rising healthcare costs, and whether that's prescriptions or doctor visits. So let's talk about that. The cost of prescriptions or doctor visits is going up faster than the rate at which we've increased contributions to put into our piggy bank here. So to address this, we either have to figure out a way to get more going in here or slow the amount that is getting poured out. And we have to do all of that and make sure that we keep good access to healthcare and keep going to the doctor, keep being healthy. All right, so now let's talk about plan design, part 3. The Labor Management Committee, or LMC, you may have heard it called as. That includes representatives from all of the bargaining groups, along with all of the meet and confer groups, and they're working with George. If you've heard of George before, he's our employee benefits consultant, works for a company called One Digital, to explore options. So what is a plan design? It basically outlines how costs are covered. What do you have for copays? What do you have for deductibles? What do you pay for pharmacy? All that kind of stuff. So for example, our current plan is a $20 copay and $1,000 deductible for family. So here's how that works. You go to the doctor, you pay $20 for your copay. But let's say that visit actually costs $250, like I mentioned earlier. Well then, now you pay the $20, but that $230, where does it get paid off of? Not out of some kind of pot over here from some other organization, some other company. No, it's our piggy bank. That $230 comes out of our piggy bank. Let's talk about the deductible, right? So you have some $1,000 procedure and it's covered 80/20. Well, that means you pay the first $200 out of your deductible, and then the other $800 comes out of here. Let's say you've met your deductible, so you don't have to pay anything at this point. And it's a $2,000 procedure. Well, now you're not paying anything, but that $2,000 is all coming out of here. That, in a sense, is why more is coming out than is going in. So let's talk about what the different plans might be. Essentially, you vary how big your copay would be or how big your deductible would be. So when you raise your deductible, high deductible, when you have a high deductible plan, they typically have lower premiums. And lower deductible plans typically have higher premiums. Money has to get in here some way, whether it's through premiums or deductibles. But that's the differences that the LMC is working on right now. So do you shift from a copay plan? They're thinking about that to a higher deductible plan, or do you stick with the copay plan and increase premiums? So that they match the expenses? Do you look at a healthcare savings account plan, or HSA for short? That saves you money for future medical expenses, and in the meantime, it can grow money in your accounts through, like a stock market or like a 403b. So decisions are being made by LMC about the next plan design, and again, they're just trying to balance maintaining coverage and managing costs for everyone involved. All right, so now topic number 4, which is what can we do right now? What can you do? What can I do? Because we're all in the same plan together. Because there are things that we can do, and it really focuses on slowing how much money is coming out of here so that we don't have to raise premiums or deductibles or anything as much. So what can you do to slow it? Now, don't ask me why. I don't know why. But the same drug or the same prescription can cost significantly different amounts at different places that you go. So oftentimes the CVS, which is super convenient, it's in Target, I get it, but oftentimes that's some of the highest cost for that same drug that you could get way less going across the street. Now you don't see the difference because your copay is going to be the same, but it's more coming out of here. And the more that comes out of here, the more we have to increase premiums or increase deductibles. Another example is, I'll use an example from my wife. She had a sinus infection and she couldn't get an appointment, or just a regular appointment. And so she was going to go to urgent care. I encouraged her to try out Teladoc. She did. She loved it because she got her prescription quicker. She got it from home. And in terms of this, the most that you would pour out of here is if she went to urgent care. Then a little bit less of a pour would be as if she went to her regular doctor. But the least amount that comes out of here is if you use something like Teladoc. So getting in-home service, not having to wait in the waiting room, and lessening the need for future increases to our premiums. So we can work on this together because this is what's happened over time, right? Like we've raised things. You remember years where we raised them by 10%. That was last year. Before, we've had years of 0, we've had years of 5, but they just haven't kept up. But if we can work together to drop the amount that's coming out, then it lessens the need for us to increase the amount going in. So, the recap. Our healthcare reserves have been significantly reduced over time. And it's not due to profits taken from some healthcare company, because for the most part, like we're our own healthcare company. And it's not because the district is using those funds for something else, because we can't. Like the money that comes out of my paycheck and your paycheck for deductibles, plus the money that the district puts in on our behalf, that all has to be used for healthcare. The amount that we're putting in is not going up at the same rate as the costs of the stuff that takes it out. And we are all in this together. So I want to be clear on this. No one should stop going to the doctor or getting their prescriptions. You need to continue to get quality care for what your needs are. There's just ways that we can do so, and that would lessen the impact on our collective piggy bank. And in addition to that, the LMC is working on a redesign. So you'll see on one of these sides, you'll see a description of the dates of the meetings or timeline of the LMC's meetings. And this is just the start of an ongoing conversation. We're going to share more updates throughout the LMC's exploration process. And if you have any ideas on how we can address this, please reach out to your LMC contact, whether that's your union rep or your representative from Meet and Confer. because that's what they're working on right now, and they are more than ready to use any ideas or any input that you have. Be back again. Thanks.